Mr. Humphrey. My name is Jean. I'm the tech that's going to be helping you with Raja today. Today we'll be giving Raja a vaccine that vaccinates against multiple diseases. It is the FERCP vaccine, and it is the feline viral rhinotracheitis, calici, and panleukopenia. Panleukopenia is spread through direct fecal to oral contact, and it is very stable and stays in the environment for a very long time. Some of the symptoms you'll see with panleukopenia include vomiting, diarrhea, and dehydration. There's no specific therapy to treat panleukopenia. You have supportive care, and that would include fluids, vitamin B complexes, antibiotics for if there's any secondary infections, anti-vomiting medications, and nutritional therapy. Feline rhinotracheitis virus and feline calici virus are both upper respiratory viruses. The feline rhinotracheitis virus is transmitted through direct contact and is spread through ocular and nasal and oral secretions. It can also happen through mutual grooming. Recovered cats that have this disease can spread this disease from months to years afterwards. Clinical signs for the rhinotracheitis virus: sneezing, ocular and nasal discharge, even conjunctivitis or corneal ulcerations. The feline calici virus is also an upper respiratory virus and is transmitted through cat-to-cat contact or ocular, nasal, and oral secretions. And acute forms of the disease, it can be spread through blood, urine, and feces. This particular virus can remain in the environment for stable in the environment for 1 to 4 weeks. Clinical signs with the calici virus are dependent on the strain. So you can see sneezing, conjunctivitis, oral nasal discharge, or oral ulcerations on the tongue are very common as well, and this can cause some hypersalivation. And the ulcerations can also occur on the face. There's also a hemorrhagic calici virus that is a highly fatal form of the virus. Treatment is, supportive. There's no specific therapy, so this is nursing care, cleaning the eyes and the nose, and giving it some odorous food that it would want to eat, because it's hard for them to smell because they'll have a lot of nasal discharge in their nose. Antibiotics and fluids as well. Another vaccine that we will give today is for the leukemia virus, and this is transmitted through social contact, and it's with saliva. It also shed in the blood, urine, feces, and nasal secretions. This can be done with sharing food and water bowls with infected cats, mutual grooming, and bite wounds. Some of the symptoms you'll see with feline leukemia can include fever, can include weight loss, it can include upper respiratory infections, and in latent infections, it could be asymptomatic, where we don't see any symptoms at all. The best way to protect Raja from any of these diseases is just to vaccinate and keep up with the vaccination schedule. So today we'll give Raja his initial vaccines, and then in a couple weeks, in 3 to 4 weeks, he'll come back for another set of vaccines, and then after that he will come back for another set of vaccines, and then every year after that he will booster his vaccines annually.